Okay, so the last one we did there was the standing pivot transfer. This time we're gonna do the squat pivot transfer. So this transfer here is similar but a little bit different. The big difference with this is the client over here doesn't fully stand up. They stay at a squatting position, and the therapist or a caregiver or whoever is making the transfer stays at a bent over position. Again, I always want to focus on proper and good body mechanics. So I want to bend at the waist, keep a tight, strong core, lift from your legs. You want to have the client do all the work. Make sure the client doesn't grab around your neck there. So what we'll do, we'll get Miss Emma here into the other chair for the squat pivot transfer. So as I mentioned before, in the other part of that, in the first transfer, I like to set up the room, get everything out of the way. We'll bring the chair in over here in a minute, but for now, it'll be easier for her to swing her legs out here if the chair's not in the way. You just don't want her to kick that and injure herself there, and that would just not be good. So, how you doing, Emma?
Good.
Awesome. Are you ready to get in this chair again over here?
Yes, chair.
Awesome, sounds like a plan. Okay, so what we're gonna do first of all, just like the last one, we're gonna go from supine, which is laying down, to sitting up nice and tall, and then we'll get you from this chair over into that chair over here. So first step that I want you to do, again, you wanna have the patient here doing as much of the work as they possibly can, but you always, of course, wanna make sure it's safe for them, safe for yourself here, so always monitoring them, helping out in areas that you need to help out, but it's really about promoting independence there. So first of all, let's see if you can get your legs off of the couch here onto the floor. So you can start by swinging that leg over there. I'll get out of your way if you can do that by yourself there. Then we'll take this leg over here. Okay, awesome. And as I mentioned for the other transfer there as well, you want to get them as close to the edge of the couch or bed that they're in there. If they're further away, far away from you there, it's a lot tougher to get them up and out of whatever they're sitting in or laying in there. So now what we'll do is I'll help you a little bit here. I know you're feeling a little bit tired now, so after all the stuff we've been doing today,
Yes.
I'll turn you on your side a little bit here. Awesome. Oh wow, there we go. Then you can get this hands and place it right there. And then when you're ready, take your time. You can push off on that, and we're just going to come up to a seated position there. So when you're ready, I'll give you a hand here. Okay, perfect. Nice job, Emma. We'll kind of straighten you out here too. And one thing I forgot to mention in the standing pivot transfer is a lot of times when someone comes from supine, laying flat on their back, up to sitting, you want to make sure they do it nice and slowly, because one thing that happened a lot that might have happened here to Miss Emma that I forgot to check with for the first part is she might be feeling a little bit dizzy. So you're feeling dizzy right now?
No, I'm okay.
Okay, awesome. So she's feeling okay. If the patient is feeling a little bit dizzy, all you want to do is just give them a couple minutes here to kind of take their time, catch their breath. Potentially, if they're feeling really dizzy and kind of out of it, you might want to check their vital signs. But as I mentioned, as she mentioned here, she's feeling okay, so we'll keep going with the transfer. Now she's sitting up nice and tall here, nice good upright posture. She has both her knees bent at a 90-degree angle, her feet about shoulder width apart there, that's looking good. So what I'm getting at with that is she's ready to transfer. So now is when you bring the chair in here at that 45 to 90-degree angle, nice and close to them, but far enough where we have a little bit of room to work there. For the squat pivot transfer, so this one, as I mentioned, she's not going to stand up fully. She's going to stay in a squatted kind of bent position. This is usually a little bit quicker transfer. And this one is used if someone is non-weight bearing, they can't fully stand, they're feeling a little bit weak. So different things like that. The squat pivot transfer has the client do more work than this one does here. This one is a little bit more work for the therapist, but if proper body mechanics are utilized, then it should be nice and easy and swift right into the other chair there. So you should never feel like you're throwing someone around or lifting a ton of weight there. A smaller female therapist could easily lift a 200-pound man with this transfer there if utilizing proper body mechanics there. So similar setup here. This time I'm going to get Emma's knees a little bit closer together there. I'm going to get on the outside of her legs. And another point here too, it's not relevant with her, but if someone had left side hemiparalysis, you might need to block their affected leg. So I would get my foot in here by her foot, get right up against her knee or her shin. In case that leg were to kind of give out or buckle there, I can block that to give her better balance there. So She's feeling really good today, a little bit tired, but so that shouldn't be an issue. Just wanted to mention that there, in case that's something you need to look out for there. I always want to check with the client there, make sure, see how they're doing, how they're feeling today. A big thing with transfers is she could transfer right now, absolutely amazing, but later on tonight you can try and transfer her there, and it could be a completely different experience depending on how she's feeling, what's going on, if she's in any pain, things like that. So it's always important to really check with her there and just make sure things are looking good. Okay, so now I'm going to come in here, just like before. I'm going to get nice and close there. So you always want to make sure you don't have really strong perfume or cologne or things like that, because she could be really sensitive to some of those smells, and if you're getting really close for transfers, that's going to make it really uncomfortable for her and unfortunate there. Also, too, if you had a lunch that consisted of onions and garlic, then getting in close and talking to her is not going to be a pleasant experience for her, and she's not going to want to work with me in the future there. So just a couple little pointers there. So I'm going to get in here nice and close. I'm going to reach on down. As I mentioned before, always proper body mechanics. So bending at the waist there, taking your time, really engaging your core, lifting from the legs. I'll get in here. I'm going to grab the back of your pants. Ideally, it would be a transfer belt, but we don't have that right now. And what I'm going to do, this time I want you to lean forward as far as you can there. Get your nose over your toes, and actually your nose can come onto my shoulder here. So kind of get onto my shoulder there. And I don't want you to grab around my neck. You can grab around my back if you want to there. That might be easier if you do that there. That's perfect. On the count of 3, we'll get you from this chair into the next chair. So get a nice rocking motion. Always important to get momentum there. So 1, 2, and 3. Perfect. There we go. And now she's a little bit closer to the edge of the chair. So what we're going to do, I can lift you up again a little bit here. We'll kind of scoot you on back. Perfect. Maybe one more time here. Okay, awesome. There we go. Does that feel okay? Awesome. So one thing I want to talk about too, if a caregiver has any questions, they can always reach out to their supervisors, occupational therapists, occupational therapy assistants, different people like that there. So there's always good resources. As I mentioned earlier too, that was the squat pivot transfer. So that's for someone who can't fully stand up or is a little unstable, maybe hemiparalysis on one side there. So that was what we used a squat pivot transfer there for. The stand pivot transfer was the first one in the video. That's for someone who feels a little bit more comfortable and stable, and they're able to stand up for a little bit and move with you there. So those are the 2 transfers.